start with telling us who you are and what you do.
My name is Dr. Garcia. I'm the owner and founder of Green Dog.
How diagnostic imaging is used for my dog.
Diagnostic imaging is the most non-invasive way of being able to diagnose disease in dogs. It's one of the most important things that we use in veterinary medicine as veterinarians. And the reason why is because by having diagnostic imaging, what it allows us to do is to be able to see inside of pets, dogs and cats, in a way that is non-invasive. It's not surgical, it's something that doesn't require any poking or prodding, and it's something that can be used to basically find out what's going on. Now, there's a lot of different things that may be going on in a dog or cat when it comes down to diagnostic imaging and why we use it. So there's quite a few different imaging modalities that we can use. One of them is CAT scans, CTs, MRIs, ultrasounds, and others.
What are the different types of diagnostic imaging you have here in-house?
A few of the different diagnostic imaging modalities that we have here are ultrasound, X-ray, and CT. In ultrasound, we can use it to do diseases of the abdomen, sometimes also of the chest, and sometimes also of muscles and ligaments. We also use X-ray. X-ray is really good for bones. X-ray is good for heart. X-ray is good for abdomen. X-ray is also good to diagnose cancer. So those two things are ones that we use most commonly. And in patients that need more advanced imaging modality, we have CT here. And CT is a very, very exciting thing for us. And the reason why is because CT is a three-dimensional image. And what that allows us to do is to see a patient from a three-dimensional structure. And what that means is that there's thousands of images that are pulled in a CT, and those images are created, and then we can create an actual image to where we can see it in a three-dimensional way. And in that, we can diagnose diseases much, much more pinpoint. We could see cancers very specifically. We could see nodules in the lungs very specifically. And it's really, really good for cancer diagnoses. And it's also good for finding different things in the abdomen that we might miss with other imaging modalities.
Why do pets need these types of imagings, or what would a veterinarian look for?
The nice thing about diagnostic imaging is that it's the easiest way for us to look inside of a patient without having to sedate them sometimes, without having to do any surgery on them. It's a way to look inside of the patient very non-invasively. And what that means is that when you're non-invasive, that means that we don't have to do anything surgical. We don't have to hurt the patient in any way. Let me try that again. Ask that question again.
What are some of the things a veterinarian would look for, or why our pet would get one of these?
So in diagnostic imaging, what we do is that we're looking for things that we can't see with our eyes. And what that means is that we take X-rays or we do ultrasounds and look inside of the body. So what we're looking for is heart disease, lung disease, disease of the liver, the kidneys, the spleen, anywhere inside of the abdomen, and a lot of things that I'm not mentioning, okay? And when it comes down to imaging itself, I personally love to use imaging because I don't have to do anything invasive to the patient. I can take a snapshot with an X-ray, or I can take an ultrasound probe, take a look inside, or with a CT, I can get a three-dimensional image. And with that, I can bring over a lot of the information to the client as far as what may be going on with the patient. And that is very, very valuable without ever having to even go into surgery.
When my dog is getting some form of diagnostic imaging, do they need to be sedated or have anesthesia?
It depends on the procedure. Mostly for X-rays, they don't need to be sedated. Ultrasounds, they don't need to be sedated, but for CTs, they do. And the reason why in CTs they do need to be sedated or put under anesthesia possibly is because the patients can't be moving for those procedures or for that particular diagnostic study. That patient needs to be completely still because, again, in a CT, you're taking thousands of images that are being done within minutes. So with that, the patient can't be moving and has to be still. For other procedures, a patient may need to be sedated, would be maybe for an X-ray of a limb that may be painful. So if we have to have a patient down to having an x-ray of that limb, if we're pulling that arm or maneuvering that patient and that's a painful procedure, then at that point we need to sedate them so they don't feel the pain. And that is something, so in that particular situation, that circumstance, the reason why we're doing it is because we don't want them to feel pain due to an injury. If you had an injury to your shoulder or to your leg, it'd be painful if somebody was pulling on it. But sometimes we need to do that in order to get the proper imaging study done and the right imaging study done.
Is diagnostic imaging safe for my dog?
It's completely safe. That's the reason why we love using it. Diagnostic imaging is one of those ways that we can find out so much information without ever having to put a scalpel on your dog or to cut your dog or to do anything that might be painful for them.
With all the different types of diagnostic imaging out there, which tool is most accurate?
They're all accurate in different ways. X-ray is really good for bone. Ultrasound's really good for the abdomen. CT is really good for spines and backs. It just really, really depends on what the particular situation is and why you're doing the study. The veterinarian decides which one they need to use. The veterinarian decides whether they need to use more than one. Sometimes we start with one and then we need to add on another one. Because sometimes, think of this as pieces of a puzzle. Sometimes we have one imaging modality that gives us one piece, and then we get another one that gives another, and with that we're able to see what's going on.
That being said, what are the factors or determinations that you use to decide whether they use an X-ray, an MRI, or an ultrasound?
We usually start to go easy first. X-rays is usually one of the more easy ways to kind of start. Ultrasounds are one of the easier ways to start. For example, if I know a patient has a painful bone in his body from my physical exam, that's going to be more prone to doing an X-ray on that patient. If a patient's been vomiting for a few days or having diarrhea, depending on the veterinarian, an ultrasound may be the way to go. In this particular situation, I think it's important to note that ultrasound does require some expertise in being able, and some experience and training to be able to perform the actual study. Here at Green Dog, we have Dr. Geist, who's an internal medicine specialist who's been trained in doing abdominal ultrasounds. Myself, I spent 18 months in an imaging facility working strictly doing ultrasounds, so I have a lot of experience doing ultrasounds as well. So here at Green Dog, we have many different doctors that have extensive experience being able to perform an ultrasound.
With that, do I get my pet's results same day, the day of my appointment?
Depends on the study. Ultrasounds you do because the person who's performing it is going to be able to tell you exactly what they see in real time. An ultrasound is a real-time study. On X-ray, it really, really depends, only because sometimes what we see needs to be backed up by another opinion. And that's where a board-certified veterinary radiologist is used. So sometimes when a veterinarian may see something in an X-ray, but they're not too sure because they might not be experienced enough, or maybe they haven't seen a case, or maybe the case is a little bit more complicated, then they're going to want to send this to a board-certified veterinary radiologist. What that means is that we get the images, we upload them onto a server, a board-certified radiologist reads those images and sends us back a written report. Board-certified radiologists, this is basically all they do every single day. They sit down, they read veterinary X-rays all day long, and they write reports. Us as veterinarians, we do a lot of different things in-house. We do vaccines, blood work, we diagnose disease. We're not necessarily reading X-rays all day long. So having a radiologist backup, a radiologist opinion to kind of confirm some of the things that we see in-house, sometimes it gives us, again, that secondary confidence, that secondary opinion, that expertise that's going to be able to say, this is what's going on. And that allows us as clinicians to feel a lot more comfortable in those kinds of situations.
Is there any recovery that happens after one of these procedures or imaging?
The only recovery is if they're sedated. So it's really recovering off the medications that were given, but the actual procedure itself, since it is a non-invasive procedure, does not require any particular recovery time. It's just maybe mainly coming off the medications that may have been given in order to perform the study.
Does my dog feel any pain from any of these imaging devices?
There's no pain associated with any imaging device. The only pain they may feel is from the injury itself or the ailment that's bringing them in for the imaging study. And in those particular situations, we would give a sedative if we felt like the patient was in pain.
What can I expect from a dog diagnostic imaging session? Do I need to prepare my dog or myself for his imaging session?
Every dog or cat that comes in for an imaging session, we ask them to be fasted the morning of. And the reason why is because if there's any food inside the stomach or the intestines, sometimes that can block our view of what we're trying to look at. On the morning of, we want them to be fasted. Another reason why we might want them fasted is because we may sedate the patient. And it's always best for the patient to be fasted and have no food in their system, for them to be sedated as well.
What happens if there's no diagnosis after we've done the diagnostic imaging of my pet?
It depends on the study. Sometimes we will get an inconclusive result. If we get an inconclusive result, then what we're going to do is we're going to send that off for a second opinion, send it off to a board-certified veterinary radiologist. Sometimes they'll be able to send us back their opinion to guide us on when the next steps may be. The next steps may be another imaging study. So let's say if we start off with an X-ray and ultrasound, maybe it might move on to a CT from there, or it might move on to another procedure that is not associated with imaging.
What happens to my dog during an X-ray?
During an X-ray, the patient, dog or cat, is usually put on their side or on their back, and then the X-ray is taken. Those X-rays are all digital here at Green Dog, and those X-rays are uploaded onto a server. They're all put onto a computer, and then we're able to adjust those images and see that on some pretty advanced software, and to be able to look at everything on a computer. So X-rays traditionally were done on film. Here at Green Dog, they're done 100% digitally.
What are the baseline diagnostic images, and why are they important for my pet?
The baseline diagnostic imaging that should be done on any pet, and this really goes more along the lines of more of preventative medicine and wellness, which is something here at Green Dog we really do focus on, is as dogs get older, sometimes we don't want to only image them when they're sick. We want to image them when they're also healthy. And the reason why is because we want to find if there's anything that may be brewing, anything that may be kind of starting up before they show it. So what we do is we recommend here at Green Dog that dogs over a certain age, 6, 7 years old, depending on the patient, or if they have any maybe history of any medical issues, we may recommend that they start having baseline X-rays or baseline ultrasound to be done on an annual basis. And that's something that we really do focus on here at Green Dog. You know, we want our patients to live longer, and by doing that, preventative medicine is a really big key in that. Imaging being a non-invasive modality, a non-invasive way of seeing inside of the body. If we're able to look inside on patients before they're sick, we might be able to find things before they become a problem. And in that, we're going to get them to live longer, and that's our goal.
When should I start bringing my pet in for diagnostic imaging?
Usually your pet is recommended to start diagnostic imaging when there's an abnormality that's found either on a physical exam or on blood work. So typically, if there's something abnormal, the doctor's going to recommend, or the veterinarian's going to recommend, that an imaging study be done. Another reason why you would do an imaging study is on a preventative basis. As dogs get older, it's always good to start doing preventative blood work, preventative imaging, and you do it on these cases to where we don't want the patients to come in when they're sick, we want them to come in when they're healthy, and us to be able to make sure that we're catching things before they become a problem.
Will my pet need a lab test prior to the diagnostic imaging?
Not always, but typically by having a lab test that comes back abnormal is what indicates for us to order an imaging study, whether that's ultrasound, CT, or X-ray.